All right, welcome everyone, and thanks for joining us. I'm excited to take a deep dive here into the mind of today's healthcare workers and reveal the results of Hireology's most recent 2023 applicant research. My name is Adam Robinson. I'm excited to be here with all of you this morning. I'm the founder and CEO of Hireology. We're a talent technology platform that helps healthcare providers recruit and hire their best possible team so that they can stay staffed to deliver the service that they need to deliver. Let's jump in. So I want to start out with a quick overview of today's market conditions. Today, it feels like there are two conflicting job markets. On one hand, we hear stories about the technology and professional white collar space. Many businesses in this sector are really grappling with slowdown in demand and with layoffs. We hear stories of hiring freezes due to what may be a pending recession. I know we've been talking about the pending recession for a year now that has yet to arrive, but businesses are really hunkering down in the professional space. And it's really, I could say they're experiencing a hangover from overhiring during the pandemic and post-pandemic years. And this has left the number of active job seekers in the market in these sectors outweighing the number of open jobs. So in the professional space, we've got more job seekers than jobs open in the United States. But like with other industries that, like this one, that employ hourly essential workers with very specific skills, this sector, the healthcare sector, is facing a completely different reality. So facilities that offer long-term care, skilled nursing, acute care, rehab, and similar services in facilities are struggling more and more with hiring and retention, really more than any other type of employer in the US right now. And given the continued shortage of active job seekers on the market in this industry, most of you I know are having trouble building a pipeline of talent that's consistent and strong enough to quickly fill the roles that you need to fill. So what's causing all of these issues? And what's causing the churn and burnout in this industry? Well, burnout impacts healthcare workers more than it does really in any other industry. Nurses, CNAs, and other caregivers served long hours in person and on the front lines over the last 3 years, which really impacted both their mental and physical health. And now that the economy is back in full swing, and hiring is really booming in other skilled labor and hourly workforce sectors, many are choosing to pursue lower stress, more flexible work elsewhere. Now, unfortunately for us, this means we have sometimes an inability to care for patients at the levels that we want and to make sure staffing coverage on beds is hit, which ultimately impacts the service you can provide, and through that, impacts your bottom line negatively. So all that is to say that building a solid pipeline of great talent and retaining that talent is really critical. But workers in this sector absolutely have the upper hand right now, compelling all of us to adjust our offerings and hiring processes to meet their needs, or we risk leaving critical patient-facing roles and ultimately beds unfilled. And so the key for healthcare facilities is to better understand the mindset of today's healthcare workforce so we can adjust our hiring offerings and processes to stand out. And that's what we're going to talk about for the next half hour or so. So what we set out to do with our annual applicant research is to really understand what's driving decision-making amongst today's job seeker. So we surveyed 675 healthcare job seekers with questions around the following themes. First, what are job seeker expectations for the application and hiring process? Second, what do top job seekers look for when they look for a new employer? And third, what keeps these great employees loyal to you over time? And so we're revealing these results today with you. This is the first time this has been released. This is hot off the press. And so thanks for joining me today to be first to hear the latest research. So let's jump in. So we broke down the results into 6 different takeaways, which represent the primary characteristics of the modern healthcare job seeker. First and foremost, the data overwhelmingly shows that the healthcare job seeker today is eager to get to work. It's easy to assume that the problem is simply that people don't want to work, but the data in our latest research shows quite the opposite. Those who are actively looking for work are ready to be interviewed and hire fast. In fact, our research found that just over a quarter of respondents said that they want to be interviewed, not just contacted by an employer, but actually interviewed within 48 hours of applying to a job, while over half said 3 days was the mark within which they'd like to be interviewed. So sum all that up, what that means is our teams need to be equipped to contact applicants immediately after they apply so that we can find time to set up an interview within 2 to 3 days after submission, ideally within 24 hours. Why does this matter so much? Well, because nearly half of our healthcare respondents admitted that they'd be likely to ghost the interview if those timing expectations weren't met. So in other words, by simply waiting too long to schedule a first interview, you could be missing out on a huge chunk of the best candidates who are likely taking jobs elsewhere at faster moving competitors. Another point of evidence to our argument that most job seekers are eager to get on your payroll is that 57% of these healthcare job seekers in the survey said they accepted the first offer they received in their search. They're not waiting around to compare offers. If they like the job, they're good with the setup and the benefits and the offer, they're taking it, period. In fact, what we find is that nearly 90% of all hires made by healthcare facilities through our platform were job seekers who were responded to within 72 hours of their application. And so I'll say that differently. If you're finding that you're getting interviews scheduled more than 72 hours after the initial job seeker application, you're missing out on about 90% of the market. And so the key question to ask is our recruiting operation, or our recruiting efforts, are the systems we have in place enabling us to move really, really quickly? Because the evidence shows here overwhelmingly the first to make the offer gets the hire more than half the time. Now, along with being eager to work, today's top healthcare job seekers are open-minded when it comes to where they look for work. They're not relying on just one single channel to search for jobs, and they're not putting all their eggs into just one or two baskets. So let's take a closer look at that. First, let's take a look at what I mean by not putting eggs into one or two baskets. 34% of survey respondents said they applied to more than 16 jobs in their most recent search. And a total of 46%, or just about half, said they applied to more than 11. So what this means is that when someone applies to your open role, they're also looking at about a dozen additional opportunities in the work. So if you're not able to give them what they want in terms of hiring speed or with the job itself, they're casting such a wide net that they can move very, very quickly on to other options. And so the operative question here to ask yourself is, what are we doing in our offering and with our hiring process that's going to help us stand out from the 11 other employers or 15 other employers that this individual has applied to? Now, similarly, they're not going to rely on just one or two channels to search for jobs. They're going to see what they can get across a range of sources. Of course, by and large, general job boards, like our friends at Indeed, are the most commonly used source, but we ask people to check all that apply, and you'll see that no other source really stands out as the second highest. People are Googling, they're going to social media, they're going directly to career sites that you host for your business, and they're asking their friends and acquaintances if they know about open opportunities. So in other words, people are searching everywhere for the right opportunity, and they're really not leaving any stone unturned. And so for you, what this means is that your chances of reaching the best possible job seeker out there is by having a presence on all of the channels, not just ads on a job board. Certainly you need to do that, but you've got to do all of the above today. And then I wanted to make a note about employee referrals, because I think this is really critical. So while in the last question, only about 31% said that they're actively networking with friends and peers when looking for work, nearly 90% said that if someone they know in their network, they know and trust, vouches for your company, they're much more likely to apply to that job, 90%. And so that really speaks to the benefit of having a robust referral program internally that incentivizes your team to reach out to their networks rather than waiting for candidates to contact them via social media. And so by and large, job seekers will apply to jobs if someone they know encourages them to do so. But because they're not necessarily seeking these networking opportunities out themselves, only about a third do that, it's important to put the onus on your existing team to reach out and start those conversations. And of course, that's where a great referral program comes into play. Not only just having the program, but having the tools and technology in place to drive results systematically and consistently through technology. You should constantly communicate about open roles, make it really easy for your team to submit referrals. So think via text or chatbot, which our platform certainly supports, and pay a meaningful reward or bonus that's appropriate for the role for which you are recruiting. And we know job seekers, as we've said, will leave no stones unturned in their search for what's right for them. But what does right mean? It's easy for employers to assume that job seekers are simply holding out for the highest paying option. But the reality is that job seeker expectations are much more nuanced than that, especially in our space. So of course, pay matters, and it always will. We have to pay people market rate and pay fairly, but caregivers are willing to take lower paying jobs if the rest of their expectations are met. So let's take a look at what those expectations are. So we asked applicants what they would do when presented with two options in a similar pay range. Only about 9% of healthcare respondents said they'd always choose the higher paying option, which means 91% would be open to taking the lower paying offer if the right benefits were offered. This is up about 7% from last year, where we were tracking at about 84%, which benefits would job seekers prioritize over pay? Well, there are four that top the list. Number one, schedule flexibility. Can I work for an employer that's willing to work with me and meet me where I am in my personal needs in my life? Second would be career growth. Is this more than just a paycheck? If I come to work for you, what's in it for me over the next 12, 18, 24 months that give me not just a job, but a career? Third would be fulfilling work. Now we have that in spades just by default in this industry. Caregivers in this space always cite the fulfillment that comes with providing care to others. That's third on the list. And then good working culture is fourth and at the top of the list. And so while benefits like schedule flexibility and career growth are fairly straightforward for employers to define and for job seekers to identify and connect with, culture is a little more murky. So it's not always clear at face value what an employer's culture might look like. And from the employer's perspective, it's not obvious what job seekers are even looking for. And so we asked respondents in an open-ended question to define good company culture. And so I'll read from a couple of these here. One respondent said, inclusive, kind and caring, open to accommodations, working on growth and reflection, care about its employees rather than seeing us as disposable. Another respondent said, a good corporate culture fosters a positive work environment that values and supports employees, encourages innovation and collaboration, and upholds ethical and social responsibility. So what we can see here is that, while everyone is looking for something a little bit different, there are some common themes here. And it's a workplace that's kind and inclusive, where we're focused on the mission and where everyone's treated equally and with respect. Those are the things that really drive decision to join, and as we'll see later, decisions to stay. And so when analyzing all of the open-ended responses to this question, as I said, a few common themes emerge. So typically a good culture means, first, well-defined core values, right? What does your business stand for? What are the rules of the road that we know are true when we're confronted with gray area opportunity, and are those values lived and enforced through management? Second, feedback is given when appropriate, both positive and constructive. So I get regular feedback from my direct manager or from the company, both when I do a job well done and also when there's coaching opportunities. Third, there are growth and training opportunities for all types of roles. So it's not just throw me on the roster and hope that I can swim. It's going to be a support structure around that individual that helps them get onboarded in a way that helps them get up to speed faster and feel supported. Fourth, a diverse workforce, right? A workforce that's diverse, that's inclusive, and where people are treated equitably. Then we've got leadership transparency. Really, this the job seeker saying or employees saying, I understand the decisions that the leaders in this company make. I understand why they make them, and I understand how those decisions lead to the business outcomes that we're trying to drive here. That really speaks to communicating inward to your employee base about the state of the business and how things are going on a frequent basis. And then finally, they just note that people treat each other with kindness and empathy, as I said before. And almost all of these characteristics are completely within your control. And that's really the good news here. You can define clear core values and prioritize hiring people who embody those values. At Hireology, we actually have a core value interview step in our hiring process where we interview a potential hire through the lens of our core values. It gives them a glimpse into what we're all about and also helps us help them understand if that culture and that value system is the right one for them and for us. So it's also important to offer a feedback loop and train managers, of course, on how to properly provide feedback. So it's one thing to say, just give feedback. It's another thing for your organization to actually train managers on how to give feedback constructively and how to properly provide that. Training offerings and opportunities to build out career paths, and of course, a built out, understood, and communicated diversity, equity, and inclusion strategy. Now, of course, always being open and honest with your team and leading with kindness is really the rule of the day here. Some of this might feel simple, but as a whole, this is really what people are looking for in culture. And I think where most orgs run into trouble with this is when their leadership doesn't align with these characteristics. So these themes really, the genesis, the origination of these themes has to really be at the top of the organization. Factors like empathy, inclusion, transparency, they need to trickle down from the top. And if the leadership team isn't leading by example and saying that these things are important, it's really hard to propagate that throughout the organization. And so, those of you on the call who, acknowledge that your organization may have some challenges in this area, these themes, this presentation, this is a great opportunity for you to say, hey, listen, based on recent research just published, this is the stuff that we have to start thinking about. And so, of course, we would encourage you to communicate these themes up in your organization. And when asked where job seekers go to determine whether or not a potential employer's culture fits their definition, 41% of healthcare respondents say they start with the employer's career site. Surprisingly, this ranked higher than third-party review sites like Glassdoor, which is really the go-to starting point for about a quarter of all respondents. So this shows just how much value people are putting into your owned career branding materials. And so they're even trusting you and what you're saying over to third-party review sites. So if you don't already have a career site that really tells the story of your company and illustrates its culture, it's time to really start digging into that right now. And so the homework assignment, I'll give you here at the conclusion of this webinar, I want you to go to your career site and I want you to start thinking about it from a job seeker's perspective. Does this communicate the message accurately? Does it communicate it effectively? When I look at the content, do I get a glimpse of what it's like to be a part of this organization? Is it just a bunch of bullet points telling me what the job is? Or are there videos from employees telling me what it's like to work there? Is there content for managers and leaders in the business talking about what it means to be a part of that organization and what the mission of the organization is? Are they talking about the value system? Is it communicating the flexibility, the pay transparency? career growth, all of those things. The answer to any or many of those things are no. This is where I would start. Now, as a society, we've become so accustomed to convenience in all aspects of our lives. I mean, anything from ordering food to booking flights to scheduling appointments can be done instantly and on just about any device. And so the job search should be no different. Most people expect applying to a job to be as easy as ordering a ride share. And again, given the number of jobs they're applying to, they're just not going to jump through a bunch of hoops to complete an application or a hiring process that's overly complicated if they don't have to, and they don't have to. And so let's look deeper at the data here. Nearly 2/3 of healthcare respondents, over 2/3, 73%, said they have given up on a job application because it just took too long to complete. Similarly, 63% said they've chosen not to apply to a job where they were interested initially because the application required repeating information that was already on a resume, while 53% said the same about applications that required a cover letter. So again, compare this to something like ordering food or an Uber. You can do that easily online with the click of a few buttons. So why is applying for a job so much harder at so many employers? Job seekers shouldn't have to repeat information, create logins, upload cover letters, retype their resume with their thumbs on their mobile device. I mean, gather the bare minimum information up front. That's your name, that's an email address and a cell phone number, and then weed out the non-qualified candidates via screening and phone interviews and automation. Don't use a long application that requires someone to invest an hour of their day to do the weeding out for you, because it will weed everyone out, right? No one will finish it. And so your second homework assignment, after you've gone to your career site and looked at the content and asked yourself, is this compelling? Does it really tell our story? I want you to actually try to apply to a job at your own facility and just note the experience. Was it seamless? Was it easy? If you found that it required setting up a job seeker login, a username and password, that the application was a million fields long, if you were frustrated in your review, I can promise you that hundreds of job seekers trying to apply to jobs at your organization are similarly frustrated. So you start with the content, then you really analyze the ease in the application process, which of course speaks to the technology you're using to power that process. Now, job seekers' expectations for ease really don't let up after they've completed the application. Nearly half of respondents have admitted to ghosting an employer at some point during the hiring and interview process. This number is up significantly from last year, where our research showed only 20% confessed to ghosting. We can look at ghosting and say, it's the generation, it's just a sign of the times. But honestly, what our research shows is that it's because you've made it too hard for them to complete it. So let's jump into that. Why are candidates ghosting at a 45% rate? Well, the number one reason for ghosting is a lack of communication from the employer. First and foremost, I apply and I just don't hear back in a timely fashion. Followed by, this process takes too long. And then, the recruiter didn't respond to the application fast enough. So all three of these factors can, again, be tied back to ease and response. Job seeker wants to feel important and valued. They want to feel their time's valued. So the process has to be organized around their expectations. It's got to be seamless. It's got to be convenient. And it needs to keep the process moving forward. And again, if they feel like it's not, they just have plenty of other options. And so that interview that didn't show up last week, sure, it was frustrating, but analyzing the root cause of it, ask yourself the question, did we communicate with them quickly, consistently? Did we remind them of the interview? Do we have a process in place that checks in with them along the hiring process? These are all really critical questions to start asking. Again, all of these things are under your control. So in a market where we can't control the supply of CNAs in a market or caregivers in the market, we can control our content, we can control our process, and we can control speed and consistency. And when it comes to lack of communication from the employer, we followed up and we asked, what exactly do they expect? more than 25% want to hear from you at least once a day. And a total of 60% want to hear from you at least every other day. So, the punchline here is if you're not checking in with your candidates every day or two, your chances of being ghosted by your best candidates, uh, which most often means they just went with someone else, are really high, right? So, if there's one thing you can do to improve your hiring results, it's just speed the whole thing up and check in more frequently, make it more consistent, be faster, and be responsive. Those two things will greatly increase your results. Now, much like convenience, it should also go without saying that smartphones dominate our daily lives. They power everything from our daily communication to paying bills to ordering anything that we need. And again, applying to a job and moving through the hiring process is really no different. This is especially true for the roles that we're hiring for in this industry, where they're just not at a desk or on a computer all day. So think about day-to-day lives of folks in this industry, your nurses, your CNAs, they're on their feet all day long, long hours. So they need to be able to apply, to communicate with your recruiting team, and complete other hiring related tasks easily and without being required to sit down at a desktop or laptop computer. It needs to happen on their phone, which is in their lab coat all day long. So, in fact, when we asked what device they used for the majority of their most recent job search and hiring process, 55% of respondents said smartphone. Now, this number has steadily increased over the years, has really tracked smartphone adoption. Back in 2021, the smartphone was still in the minority, and now we've reached the tipping point where it's just very clearly the dominant channel. And nearly 60% said that they've given up on an application because it was too hard to complete on a mobile device. So not only do they prefer a mobile device in the process, most will actually just quit the process altogether. They'll drop out, they'll move on to one of the dozens of other opportunities they have in the works. It's too hard for them to proceed on their phones. So in your homework assignment, make sure you do it not on your desktop computer, but do it on a mobile device. Note the experience and ask yourself the question, if I was a candidate going through this process, do I feel like this is an organization that's taken the care and the time to cater to me and make this easy? Or am I jumping through HR hoops in a process that serves perhaps some administrative needs on the employer side, but is just not really tailored to an exceptional candidate experience? All right, text versus email. We all have access to email on our phones. Most respondents, 58%, agreed that they typically check text messages before email. I know I'm certainly the same way. You're probably the same way. And the same amount agreed that responding to text is just easier. So not only do they prefer using phones, they also prefer the mode of communication that is primarily on their phones. That's texting. And so they're going to check their texts before emails, and they're going to respond to texts before emails and at a much higher rate. So as an employer looking to hire quickly, you should absolutely be using SMS or text messaging as your primary channel for communicating with candidates. Email, you can do, it's also important. But if your organization is only emailing applicants in response to the resume, I would urge you to just open up your own email client. How many unread emails do you have? If you're like me, it's a shame to admit, probably in the thousands. You get a lot of junk email. I might check it once a day, but my text messages, no matter how spammy, I read and I'll delete them, but I'll read them. In fact, over 95% of text messages are read. About 30% of emails are read. So, in summary, content on our career site that tells the story, an application process that's really easy, and communication channel through text. If we do those things, we are aligning our process and approach to meet the candidate where they are and to cater to what they're looking for in terms of an experience. And so now that we've outlined everything job seekers expect throughout the application and hiring process, what happens when you get all of this right? Well, let's say you make a great hire because your process was easy and the job you offered met their needs. Now what? Well, for most employers, the reward is loyalty, which ultimately means you prevent turnover, certainly reduce it, which means you're providing better care, which means your bottom line is impacted in a really positive way. 73% of healthcare workers say they're loyal to their current employer. Now, that may surprise you in an industry where turnover rates in some of these roles exceed 100% on an annual basis. 73% feel loyalty, but our turnover rate is much higher than that. And so now I'll say it this way: your turnover rate is the tax you pay for not getting some things right. Your workforce wants to work for you. Three quarters stay there loyal. And if your turnover rate is greater than 27%, for many of you, I know it's double or triple that. What it means is you have a real opportunity to bring that down by focusing on a few things. So top reasons for loyalty and retention include, interestingly enough, directly aligned to what inspires somebody to apply to the job. So we call this the keeping your promises portion of the presentation. Number one, flexibility, schedule flexibility, nearly half, right? So you tell me you're flexible. Are you actually flexible in practice when I come to work for you? Can I pick up shifts easily? Second, fulfilling work, right? Is this place the special place that you advertise? When I get in here, does my experience actually mirror what you sold me on the front end? And then finally, pay. Pay is important. Is this what you said it would be? And again, pay doesn't top the list, and it ranks pretty similar to other factors, indicating that just increasing wage is just not the answer to recruiting and retaining top talent. Caregiver needs are much more nuanced than that, and it's really about meeting them where they are in life at a pay rate that's fair. Another factor influencing loyalty and retention is onboarding. So how well you train, you welcome, and integrate a new employee into your business can make or break your long-term relationship with them. What we found is 81% of respondents in this research study who reported a positive onboarding experience, so positive in their terms, a positive onboarding experience, said that they're loyal to their current employer, compared to only 53% of those who reported a negative onboarding experience. What is a negative onboarding experience? I mean, it could be as simple as I spent my entire first day manually filling out tax and I-9 paperwork, making copies of credentials and certifications, and sitting in a conference room all day. Did I go home after my first day and say to my significant other, God, that was a great day one? I mean, they really rolled out the red carpet for me. Or are they going home after day one and saying, geez, I don't know about this place. This seems like the last place I worked. They don't seem that attentive to me joining. They didn't really seem like they were glad I had joined. That difference, that day one experience, really influences it, right? By a huge factor. So if you want 81% of your team that you've hired new to stay with you over the long run, we really got to focus on that first week or two in the job. So this loyalty extends even after people choose to leave your organization. So more than 3 in 4 healthcare respondents said they would be willing to return to an employer that they previously worked for if the experience there was positive. So here's the grass isn't always greener portion of the survey. This speaks to not only creating a culture people appreciate, but they're also willing to come back to. But you've really got to maintain relationships with team members even after they leave your organization. And so the latter involves making sure that you're building a database of previous employed talent and nurturing those contacts via messaging about updates with your company. So maybe you implemented a new job program, maybe you've got new training, maybe benefits, maybe you've bought or sold facilities, maybe you've got new investors or leaders, maybe there's a community service project or effort, and a give back to the community program. The point is, when someone's off your roster, they leave the organization, don't start the hiring process from scratch every time you need to hire someone. You probably have years of former employee contacts sitting in a database just waiting to be nurtured. And if you're delivering on your promises and they've left for whatever reason, oh, remember, hey, that was a pretty good place to work. Let's go back and let's turn our candidate database into a source of value for our company, which will, of course, reduce our cost to hire people over the long run, but it'll speed up our ability to hire people quickly. All right, so let's summarize here our 6 main takeaways, and then I think we may have a question or two. Today's top job seekers are eager to work. They're casting wide nets across multiple channels. It's not just job boards. They value much more than pay. So remember, the number one thing they value is schedule flexibility, followed by a career path. Fourth, they're looking for ease in the process. They want an easy apply. They want to be communicated with, and they want the whole experience to be seamless and completable on their phone. And that speaks to the on-the-go nature, right? We're walking the halls and facilities. We're not sitting in front of desks. All of this needs to happen on a mobile device, and it needs to happen through SMS. And if we onboard them right, the loyalty is there. The loyalty exists today. People show up wanting to do their very best work. It's up to us as employers to deliver on these promises and build systems and programs around the individual versus having them jump through hoops that don't really meet their needs and help them succeed. So I did offer some advice throughout this presentation. I do want to give you some clear takeaways. So most of what you can do in response to everything we covered can be summarized into 3 categories: speed, quality, and intelligence. So first, quality. 10 quality candidates is, speaking the obvious here, is better than 100 poor quality candidates. So I'd rather have 10 applicants that are meaningful and employable than 100 bad ones. And I know sometimes there's comfort in applicant volume, but it also creates lots of work. And I know many of you have been on that hamster wheel. So we want to aim for quality over quantity by first building jobs, creating products, if you will, that top talent actually wants. And so the best of the best employers in healthcare have dozens of options for work. So you need to offer what this job seeker is looking for: flexibility, culture, career growth. Reaching quality candidates also means diversifying sourcing channels. So a reimagined employee referral program. I know most of you have one. Is it working? Are you managing it with email and spreadsheets? Or are you doing it through a systematic technology platform that allows this all to happen very seamlessly? Content-rich career sites that tell your story, and a presence on leading job boards. All of those things are going to help you cast the net that you need to get the funnel built that you need to build. We also know from the data that top talent gets hired really, really quickly. So now on the speed front, optimize your hiring process so that you can not only capture the best job seekers the moment they apply, but also quickly move them through a really fast and efficient vetting and selection process. So that means exploring mandates for response times internally. That means managing that with hiring managers. Set the expectation and embrace tools that allow you to automate manual work in the hiring process and more efficiently communicate with candidates. And then finally, intelligence. Much of the quality and speed related tactics discussed are really difficult without a baseline knowledge of what's working and what isn't. So we have to track the key hiring metrics in our process, such as sourcing efficiency, right? Which channels are giving me the most hires? Let's direct more time and attention there. And process adherence, which is a fancy way to say, is the team following the process? Are we responding quickly? Are we reacting quickly? Are we moving people through? Once you have the ability to track these things, we can manage these things. And particularly, in our platform here at Hireology, facility by facility at the hiring manager level, you're going to see who's getting it done and who's not, right? And that it's not, a gotcha moment. It's really more of a coaching moment, right? So we can jump in as managers and say, listen, I know your average response time is about 5 days to some of these interviews. The reason you're having trouble staying staffed, I believe, is because if you cut that time in half, you probably double your fill rates, right? We can identify bottlenecks and opportunities for improvement, and we get out of this cycle of no one's applying for these jobs, or I can't find the right people, and we start drilling into what's actually effective and trying to solve what is absolutely the number one issue in this industry. And that's what I've got for you today here. I've left some time for questions and an email address here on this slide if you wanted to contact our team with questions, additional content, or to take a look at our healthcare hiring and HR platform. And so with that, Katie, I'll ask, if there have been any questions in the chat, anyone certainly feel free to type anything you want into the chat window, and we'll get stuff addressed as it comes in.
Yeah, we'll stay tuned for questions. All questions that have been asked during the webinar have been answered.
Wonderful. Okay, taking a look at that. I think there was a question also around, does Hireology, I think I saw one flash across the screen, does it offer some of these automated tools? What I really didn't want to do is give a sales pitch for the platform, but the things that we talked about today as critical to success in the hiring space in healthcare are of course all things that our platform supports. And so if you're interested in digging deeper and seeing where Hireology may be able to help you, we certainly want to hear from you. And so feel free to email us at info@hireology.com, or email me directly at arobinson@hireology.com, and our team of healthcare hiring professionals will jump on a call with you and give you whatever you're looking for. So with that, thanks to Katie Glick, our moderator for this event. Thanks to all of you for joining. Slides will be forthcoming, and we look forward to speaking with you soon. Good luck out there, and have a wonderful Wednesday. Thanks.